Hello, my name is Ladocsi, and I'm a plastic surgeon here at Richmond Plastic Surgeons. I've been practicing for about 20 years, and today we're here to talk about liposuction. Liposuction is one of the tools that we have to improve the shape of various parts of patients' bodies. It's a very effective technique because it removes fat along a broad area with very small incisions. So today I'm here with Stacy, who's unhappy with parts of her abdomen. I think that liposuction will be a very effective tool for her. And what I'm going to do is have Stacy describe the parts of her abdomen that she's unhappy with, and I will talk about what I could do to help her. So Stacy, can you show us the parts of your abdomen that you're not happy with?
Sure. So I'm looking to have this flatter, and I tend to have a muffin top from where the scarring was, and I'm looking to have more curve in here and definition, and mainly just through this area right here and then around here.
Okay, I think we could definitely help. So the first thing that I noticed about Stacy is she's got excellent skin tone. She's really looks beautiful. She's got a relatively minor feature in the front and the areas that she described across the sides. She's had an abdominoplasty in the past, and I can see that her scar, which is covered by this excellent tattoo, is very thin and very hard to see in the areas where it's not covered. Stacy does not, unfortunately, Stacy does not scar very well. She's got some stitch marks around her belly button, and she's got some areas where she's been burned in the past. Because she does not scar well, I am going to try and hide the trocar incisions for the liposuction along the abdominoplasty scar, and I might even be able to use some of these scars in order to camouflage where her incisions are going to be. So the other really effective tool that I have for patients that have had some scarring is what's called Vaser liposuction. Vaser is a type of liposuction machine. It has a solid titanium rod. That rod vibrates back and forth about 30,000 times a second, creating a microscopic shock wave at the tip. And that shock wave will selectively remove and destroy the fat cells underneath Stacy's skin. It'll be effective at working its way through the scar tissue that's left over from the abdominoplasty. And once I treated these areas with the Vaser, then I will use a standard tumescent liposuction cannula, which is simply a steel tube with holes at one end and a vacuum at the other to remove all that exploded fatty tissue. The other thing that I'm going to try and do is create a lipo-sculpted line up and down at the middle of Stacy's rectus abdominis muscles. She's got this pretty border laterally, and what I think that I can do is to accentuate the powerful rectus muscles that she has through this technique. Only adds a few minutes, and I think it'll really give you an improvement over what's already a pretty attractive abdomen. I'll trade with you in a second. So why don't you go ahead and get dressed. The way the whole process is going to work is on the day of the surgery, Stacy will get a ride into the surgery center. I will see her and do some marking. We'll take her back to the operating room, and the anesthesiologist will provide the anesthesia for her. The first step is to inject some tumescent fluid into her tissues. That is saline solution with lidocaine and a little bit of adrenaline. The tumescent solution will allow me to give her a smoother result with less bleeding and less pain. Once the solution is injected, we'll wait about 10 minutes for the adrenaline to take effect, perform the Vaser liposuction, remove the involved tissue, the affected tissue through standard tumescent liposuction, close the incisions, put Stacy in a binder. She'll spend usually about a half an hour to an hour in the recovery room, and then she'll go home.